I touched my face and I ended up with a handprint on my face. And I thought, oh gosh, somebody's probably eating a peanut butter sandwich and I didn't realize. And
this is On Nutrition, a podcast from Mayo Clinic where we dig into the latest nutrition trends and research to help you understand what's health and what's hype. I'm Tara Schmidt, a registered dietitian with Mayo Clinic in Rochester, Minnesota. This episode, food allergies. Over 10% of adults in the U.S. have at least one food allergy. And while some may be the usual suspects like tree nuts or shellfish, there are actually over 170 possible foods that can be linked to an allergy. Why do food allergies happen? Why are they on the rise? And are there hacks to get around them, like putting tape over your lips? Here to answer all the allergy questions is Sara Wolf, a registered dietitian and clinical nutrition manager at Mayo Clinic in Rochester, Minnesota. Sara has not only seen her fair share of food allergy patients, but she's also navigated her own food allergies too. Hey, Sara.
Hi, Tara.
Thanks for joining me today.
You're welcome. Thanks for having me.
You are an expert, personally and professionally, on this topic.
It's very kind. Thank you.
We have so much to understand about food allergies beyond the fact that some people are allergic to peanut butter. So to clear things up, we're going to play a game of health or hype.
Okay.
Are you ready?
Do my best.
Okay. Health or hype. There are now more food allergies than ever before.
I would say health. There's so many different things that we're learning play into food allergy development, and there's changes our environment. There's more C-sections now than there have been. Like all sorts of things
we'll get into that.
Play into development of or likelihood to develop food allergies. So we're seeing it more and more and more.
I feel like in elementary school for me, I knew of one kiddo, maybe, right? One peer in my class with a food allergy, and we were aware of it, and we were conscious. But now, every classroom in my child's elementary school has a sign that says we are blank conscious or blank free, and it's just really different, which I'm assuming is helpful and great and comforting, especially for the parents of kiddos with food allergies. But I do think it's much more prominent.
Much more prominent.
Okay.
Ooh, yep. You're not making that up.
Okay. It's possible to outgrow a food allergy.
And that is health. Okay. Yes, you can. Yeah, it's pretty common for kids to outgrow kind of a subset of food allergies. Some of those more prominent ones that you hear about, like peanuts and shellfish and that kind of thing, they tend to stick around a little bit more, but lots of those other ones can get outgrown.
It's possible to develop an allergy later in life, so flipping it.
Yeah, also super common and something that shocks people, of course, when it happens because you've been fine your whole life. And again, environmental changes, aging with your body, the way your microbiome works and the membranes that hold all your immune cells and the permeability of those changes over time. So it's totally possible to develop an allergy as an adult.
Okay, knock on wood.
Yeah.
Health or hype, you can prevent food allergies in children by eating common allergens while pregnant. This is one I've absolutely heard. Like, make sure to eat peanut butter while you're pregnant or maybe while you're breastfeeding to get them those antibodies.
Yeah, well, I think it's very inconclusive. What we do know, though, is that the early introduction between 4 and 6 months for an infant is helpful for sure. Little bit less evidence with the pregnant moms. Okay. But we do also know that pregnant moms that eat kind of like a more Mediterranean-based diet, higher in fruits, vegetables, vitamin D, they tend to have offspring that have less incidence of allergy, though. So just a little plug for eating healthfully during pregnancy.
That. Yeah. We always plug Mediterranean. Right. So not necessarily eating the allergens themselves, but just the pattern of eating.
It's a little, like I said, inconclusive. But yes, kind of that overall diet pattern of being more Mediterranean. I know it seems to like fix a lot of things, doesn't it?
We always plug Mediterranean.
I know.
Is it possible to prevent an allergy early in life from the type of birth? Vaginal versus C-section. Are the ways that you're birthed and the ways that you were fed as an infant linked here?
Yeah. You can reduce the risk of...
We're not preventing.
We're not all the way preventing, but we know certain things might reduce the risk of developing food allergies. So when babies are born vaginally, they're exposed to some different flora and fauna, and that helps to colonize their own baby's guts.
We have a vaginal microbiome.
Yeah,
we have
absolutely.
Talked about that before.
And so that's very good for baby. And when you come out a different way through a C-section, you don't have that same benefit.
Yeah.
Same thing with breastfeeding. There's immune cells in breast milk and all that kind of thing. That's all helping you develop and mature an immune system. Whereas if you're not, and by the way, no guilt towards moms that cannot breastfeed babies. Yes. That's okay. Fed is best. We want to say that for sure. Feed your babies. But if you're wondering about the kind of things that we're seeing, it's a little bit less conclusive, but breastfed babies tend to have a little bit less incidence of allergies. And so it's probably a combination of things. They are going to be exposed to some allergens through mom's breast milk. But with that, they've also got appropriately functioning immune cells with it to teach their immune systems maybe how to navigate that.
And we also want it out there that you can have a vaginally birthed baby who is breastfed, and that baby still ends up with an allergy. Something still just happens.
Yes, so never shame a mom.
No, don't come at us, moms.
No.
Are there any common myths about food allergies you want to just get out on the table?
One of the things that people say sometimes is, I just have this mild food allergy to something. And the thing is, if it's a true food allergy, you never know if a reaction is going to be mild, moderate, severe. It doesn't necessarily mean that you consumed more of the allergen. It doesn't have to happen that it's a mild and then it gets worse with every exposure. It's really hard to know what that reaction is going to be. Okay. So it's kind of risky in a way to assume that it's always going to be mild.
And of course, we're going to talk about allergies versus intolerances, which I think can even further muddy the waters.
For sure.
Can we start with allergies 101?
Sure.
Where do allergies come from?
They are essentially just a misfiring of the immune system. For whatever reason, your immune system recognizes something that should be benign and it sees that kind of as an enemy. Yeah. And it's just truly a misfiring. And sometimes other issues like eczema and other kinds of sensitivities come right along with that. Sometimes family history of being allergic, not necessarily to a certain allergen, but just the tendency to be allergic can be a thing too. So, yeah.
And you just mentioned a little bit about family history. So let's talk about some of the risk factors. Any demographics at play here? Let's learn more about your one's risk.
Yeah. So people that develop asthma, eczema, and other allergies tend to have a higher risk for food allergies as well. Related to demographics, all non-white racial and ethnic groups tend to show significantly higher odds of developing food allergy.
Oh, wow.
And that comes down to some biological and genetic factors, but also even socioeconomic factors, that lack of access maybe to current medical information and advice about early introduction of allergens, that kind of thing.
Like what we know about introducing foods to infants, right?
And that hasn't always been a known thing. Yeah. I mean, I have a kiddo in their 20s, and that wasn't the way when he was little. And I was super concerned with it myself. We didn't know what we know today. And in fact, maybe what we were doing back then by avoiding could also be a piece in the increase in prevalence of what we're seeing today.
We just do our best.
We do with the information that we have every time. You are right.
That is our PSA to all parents out there.
Yes.
Let's talk a little bit about the difference between an allergy and an intolerance, because there is a distinct difference, but I'm not sure it's always discussed appropriately.
Yeah. A true food allergy is an immune response. It's a cascade of all sorts of things that cause awful reactions in the body at times. Very scary and life-threatening reactions at times. When we talk about a food intolerance, those are also real, but their primary sites of action are in the GI tract. You might be lactose intolerant, and when you try to drink milk, you might have gas, bloating, diarrhea, that kind of thing. And so that's all real too, but that's not going to cause some severe anaphylactic reaction. Yeah. So it is important to distinguish the two, if for safety reasons, for no other reason, because we know that people that are lactose intolerant can tolerate a small amount of milk. But if someone is truly milk allergic, even the tiniest amount can set off a cascade of a dangerous reaction.
And like you said, the severity of it in someone who's lactose intolerant might end up in the bathroom for the evening
Right.
does not need to go to the emergency department.
Correct.
Is it true that there are roughly 9 food allergens that account for about 90% of allergic reactions?
There are.
Okay.
There were 8 until just a couple years ago,
Oh.
and now there are 9
Okay.
because we've added sesame.
That's the newest
that's
one.
the newest one on the block.
So we've got milk, eggs, fish, shellfish, wheat, soy, peanuts, tree nuts, and newest one, sesame, like you said.
Yeah. Yep.
But then there are 170 foods that people can be allergic to. What is going on here? What are some of few of these that we might not expect?
Something that you might guess are other types of seeds or other things that are related from a botanical perspective to some of these other foods that are in our for sure list. Another thing that is on the scene a little bit is alpha-gal syndrome. It's an allergy that people develop essentially to the galactose in the mammal's meat.
In red meat, right?
In red meat.
Yeah.
So it's all of a sudden you're having reactions to beef, pork, that kind of thing. And it can be a super severe reaction, like an anaphylactic reaction.
These people have not had an allergy before.
No.
They're eating a steak because they've always eaten a steak.
Yeah.
But they have previously, maybe even unknowingly, been bitten by a tick.
Right.
A specific type, though.
Right. Yeah. And what's a little bit more dangerous in a way and hard to even think about this syndrome is that many of our other food allergens, you have a pretty quick reaction. With alpha-gal, there can be hours of a delay. And so you don't even think about, if even you go into the ED, what'd you just eat? Nothing.
Yeah. Yeah.
So even hard to kind of make those associations and knowing that meat isn't on our top 9 list.
Yeah.
It's just something people don't think about.
And then we have conditions like pollen food allergy syndrome. What's going on there? Is this people with itchy lips?
Yeah, it used to be called oral allergy
That's what I was
syndrome.
gonna call it.
And I think a lot of people still refer to it as that. But now we figured out it's the pollen in those plants that are in the food that end up causing that oral allergy, itchy lips, burning, not just on the lips, but in the mouth too. Some people think, oh, it's just in my mouth, it's fine. But that can actually cause a severe reaction too. So depending on what a doctor would say, what your allergist says, some people do carry epinephrine for that type of an allergy too.
Are these going to be mostly like fruits because they're on a tree and they're exposed to pollen?
Yeah, tend to be the plant varieties. Yeah.
This is maybe a stupid question. Can you just wash your fruit? Do you know what I'm saying? You just wash the pollen off.
It's more effective to peel it because then you're definitely reducing your exposure to that outside of the fruit.
Okay.
Great question, though. Good problem solving.
Food allergies can come from genetics, environmental triggers, or your immune system. When you ingest an allergen, your immune system is fighting back against what would otherwise be harmless foods. And there are more food allergies than ever before. That's partially because of changes in our food environment, as well as more C-sections. Parents can pass some immune protections along through a vaginal birth, breastfeeding, or eating a Mediterranean diet while pregnant that's higher in fruits, vegetables, and vitamin D. While some people do outgrow food allergies, the big 9 tend to stick around. Those are milk, eggs, peanuts, tree nuts, shellfish, fish, wheat, soy, and sesame. Then there are more than 100 other less common allergens, like red meat or pollen on produce. The difference between an allergy and intolerance is the response. A food intolerance may trigger a reaction in the GI tract, but an allergic reaction to a food may be a more dangerous full-body response. We'll get into that next. Sara, I brought you on today not only because you are an expert, but also you've experienced food allergies firsthand. Are you comfortable sharing how that's shown up in your life?
My food allergy history goes back to before I can remember. My parents tell me that I had my first peanut reaction when I was 18 months old.
Wow, it's so scary.
It is so scary. And I've not had a tiny child have an anaphylactic reaction, so I can only imagine as a mom what that is like. So I apparently had a peanut butter sandwich bite from my grandma. And soon after, they knew something was very wrong. I started to get hives. I started to have just lots of swelling. My eyes swelled shut. They could tell I wasn't breathing well. They had to take me in to the emergency room. So that was that. And a year or two later, I was under the care of another family member, and she, I think, gave me a plain M&M. Those also can be cross-contaminated or contain peanuts. And I did have a reaction. Wow. And then I believe my next one was probably when I was like 5 or 6 at a birthday party. Aww. So it's all these situations where, as a mom, parent of an allergic kiddo, you're thinking of how to mitigate those. I kind of did all those things. But like you mentioned earlier, I was probably the only one in my class that had an allergy. But once we figured this out, they got better at risk mitigation too. I had great friends and great families, of those friends that were careful and were not hard to work with and be with, and they wanted to protect me. Yeah. So, yeah.
Let's talk about some additional common reactions and the different categories that they might fall under. So start with skin reactions. You mentioned hives.
Yes.
Swelling. Yes. Any others that we're missing in terms of skin?
Itching. Anything that's inflammatory, then it can be all part of an anaphylactic reaction or not. And it can show up in different ways. The hives can look different, big, red, small, looks like scales. I mean, just all sorts of different types of look.
What's happening in the respiratory system?
All of that inflammation can be causing airways to tighten, not just a big one, but many of them. So it's a very scary situation when
that's
that
the
happens.
Life-threatening.
Yeah. Yep.
What about GI? So when I think of GI symptoms, like we talked about before, I think more of intolerances.
Yeah.
But is GI part of an allergic reaction as well?
It also is, yes. A food allergy reaction can set off a whole cascade of things that affect multi-organ systems all at the same time. You can end up with vomiting, diarrhea. I mean, your body's trying to get rid of the allergen, but some of it is just the reaction itself too. As far as GI goes, it's not just that alone, of course. That would be more like a intolerance. But when it comes as part of that whole food allergy kind of a reaction, and it can be pretty severe too.
Yeah.
And quick onset also.
And then let's talk about anaphylaxis itself. I think that that's the word that we associate with these scary food allergies. That's when we need emergent help, EpiPen, call 911, et cetera. What's happening with anaphylaxis?
If it really cascades into that, it becomes a life-threatening situation involving the lungs, the GI tract, lots of organ systems, and your blood pressure can drop dangerously low. It's why we need epinephrine very, very quickly when that is going to set in.
If someone knows or assumes that they're having an allergic reaction, is using an EpiPen, using epinephrine, ever risky?
It's likely more risky to decide not to use the EpiPen.
That was going to be my guess. Okay.
Yeah. There are some decision-making kind of guides that we give to people. Usually if it's involving one body system, like I'm just itchy and I'm nothing else, I probably don't have to use that EpiPen right away. But when it involves 2 body systems, we need to go use that EpiPen.
That's
and
a good
you do
rule.
need to go to the ED afterwards too.
Okay.
Yeah, I know.
So you don't just get to hang out at home.
It increases your heart rate. Also, we're monitoring your vitals. We want to make sure that you're doing well. Sometimes you need another dose of epinephrine. So there is that immediate life-saving dose you need to give, but also that monitoring that comes later. Another pitfall people have too is they think, I'm just going to take some antihistamine of some kind and I'm going to feel better. And yes, you might feel better, but it also can mask symptoms of anaphylaxis from different systems. So it might make you not have a runny nose and help your itching and all that kind of stuff, but it's not going to save your life if that reaction continues and builds. So it can be dangerous.
And that's good because my next question was going to be, is there ever a situation where you could, quote, sleep it off, right? Take your Benadryl, you feel better, and now we're okay, versus I either need to use Epi and or I need to head in.
That's a super risky thing to do, especially with like a known ingestion. You need to take that epinephrine and get into the emergency room.
Better safe than sorry, right?
When you have an EpiPen, so many times you've already had a reaction like that. So you know how scary it is. You know that you might have one like that. So it is so much better to be safe than sorry and just not delay. Just go for it.
And then they expire, right?
Yeah, they do. You have to keep getting new ones.
Do you think it's common for people to mistake food allergies with things like IBS or celiac disease or food poisoning because of some of the symptoms?
I think there could be a potential for sure. Maybe not just a food allergy, but an intolerance with all of that stuff too. Those GI symptoms can come with food allergies. So there's definite crossover in those symptoms. It definitely could be hard to know.
If someone is experiencing some of the symptoms that you had referenced, do they need a formal diagnosis?
Yes, you should, because sometimes it's actually hard to know what exactly you reacted to, too. So truly going to an allergist, that's the best bet, and formally teasing through and figuring out what you're reacting to. And they're the ones that prescribe the EpiPen.
I was going to say, that's how you're getting your EpiPen.
Yeah, you definitely need your epinephrine. So you definitely don't want to Dr. Google your allergies and try to self-treat something that could be life-threatening. We would not recommend that. We would recommend you go to your local allergist for sure.
Let's talk about food allergy testing or just allergy testing in general and kind of what it looks like. I'm thinking of like pricking the back or the arm, and we've got little boxes and squares.
And that is something that is done under controlled environments in an allergist's office where they do skin prick testing, where they introduce the allergen under the skin and they monitor that skin reaction, loosely correlating it with, are you allergic to that allergen or not? That is a very common and evidence-based way to look at allergies. There are blood tests they might want to use, but the gold standard is actually an exposure, like you do a test in the office.
Like you eat a peanut.
The way they do it, I had one of my kiddos tested for peanut allergy in this way, a peanut challenge, if you will, in the office. They start with a tiny amount and they wait, monitor for reaction, and continue. You're staying in the office, they're literally painting the inside of their lip initially with just a little bit of something, and then it goes more and more and more. And if they don't show reaction to that, then hopefully you're good to go with that allergen. And that also should never, ever be done without medical supervision. It shouldn't be done in a place that can't handle a severe allergic reaction.
An emergency.
So don't just try it at home.
Common allergic reactions to food include swelling, hives, runny nose, difficulty breathing, itching, vomiting, or diarrhea. These could be limited to certain areas of the body and could possibly be treated with an antihistamine. Just be aware that an antihistamine may hide symptoms of a more severe reaction. Because when it starts hitting multiple systems across the body, it may be an anaphylactic response. That's when you need to use your EpiPen and go to the emergency department. If you're experiencing any of those reactions but don't have a diagnosis, consider seeing an allergist to get tested. That might mean a blood test, skin prick test, or even exposure to a small dose of your potential allergen in what's called an oral food challenge. Now let's get into how to avoid these allergens in the kitchen and outside of the home. We know there's not a permanent cure for food allergies, but is it possible to reduce your reaction to an allergen?
Maybe a way to kind of encompass this a little bit is to talk about new management strategies for it. It's not that it necessarily cures it, but we're seeing more and more oral immunotherapy coming into play. And specifically with a peanut allergy, what has happened is kind of like the testing, but in a controlled way, they introduce that allergen in very small amounts and sort of train the immune system not to react to it. And they continue to challenge just a little tiny bit, though, again, under supervision, nothing anybody should ever try at home. And what can happen then is the patient becomes tolerant enough that they can tolerate maybe a peanut. Now, they wouldn't want to go out and eat them intentionally, but what that means is when you're out at a restaurant or you're in other maybe more uncontrolled environments, there's a lot less risk that you will react because of cross-contamination. So it's just a little bit of an insurance policy.
Yeah. I know someone who did that with a bee allergy. They were going into the military. Military obviously doesn't want anyone allergic to bees. They essentially got desensitized to a bee sting. So that is kind of exposure therapy. What about just basic lifestyle management in terms of improving our odds of being safe, really, right?
Right. The management with traditional food allergies is avoidance of the allergen and avoidance of the risk of cross-contamination and that kind of thing. So this is where dietitians really get involved in that piece of it, because whether we can physically go to somebody's kitchen or not, but we can ask about people's food environments, their eating environments, all the different situations you're going to find yourself in, and help problem solve and figure that out. Because ultimately, we don't want people to be restricting more than is needed. And we also don't want people to have this affect their lives so much that they can't do the things they want to do. So that's, I think, where we come in, besides nutritional adequacy and that kind of thing when we're avoiding some things, but even helping patients and families figure out the lifestyle around this, because it can be disruptive and scary.
It's overwhelming.
It can be, for sure.
Can you talk about, even just from personal experience, some of the things that you do? So like, you don't eat food from blenders, so you might not be getting a mixed up ice cream dessert from a fast food restaurant, because we don't always know. Like cutting boards in the home. I'm thinking of celiac disease too. Like we have a colleague who has 2 toasters in their homes. One is for gluten-free bread. One is for gluten-containing bread.
Absolutely. If you have a risk for having the allergen in the environment, you're wiping things down, you're making sure to wash things thoroughly. You're maybe not using porous or cutting boards that can have allergens trapped down in them and that kind of thing. So when it's your own home, I tend to not have peanut products, but also I have a family. I don't want them to avoid them either, because I don't want them to develop allergies later in life because they avoided something for too long. So it's kind of all a mitigated risk. But, if there's Halloween candy, please don't eat it right next to mom. Take care of your own wrappers. Eat it outside the house, whatever. So in general, our home is about 99% peanut free, but I want my family to enjoy those things outside the home.
Are you always making your server aware at a restaurant of any allergies that you have or your family members?
Yes, for sure.
I feel like they're getting better at that. I feel like I get asked, like, outright, like, hi, I'm Tara, your server. Are there any allergies that I need to be aware of today? I'm like, that's so nice.
I know. Thank you for asking. I know it's fabulous when that happens. And when you do mention it, it seems like they do know more about it.
I agree.
They're receiving more training, which is really good. You kind of have to look at that menu and know what's on it. I oftentimes, even before you get to the restaurant and talk to the wait staff, I will look at a menu and go, this restaurant in general might be a little bit too risky for me. Maybe we'll suggest something else or whatever. Because there's some great ethnic cuisine that's full of nuts that is not safe for me. I would love other people to be able to enjoy it, and it looks amazing. However, everybody has a different comfort threshold with that and risk tolerance. I know that I have severe reactions, so I'm not going to put myself in that kind of a situation. Looking at a menu, there might be some in the kitchen, but then that's that conversation with the wait staff. And if they don't know, it's great to talk to a chef or a restaurant manager to help understand a little bit how they handle things back there. Some restaurants, if you order a chicken breast, they're going to cook it in its own little pan, that kind of thing. So it's not like everything is a shared surface all the time. Very much just depends on the restaurant, because in others, there's a huge risk of cross-contamination and things flying everywhere. And some of the more grab and go, I'll call them, kinds of places, it might have salads or sandwiches or soups or things. And you can just imagine, as we're making things really quickly, things can fly
if there's
everywhere.
Not a glove change. And
And even if there is, it's real easy to fly nuts here or there, maybe into some lettuce. At a place like that, maybe a soup is a less risky choice than a salad that lives right next to some other nuts or things you can't have.
It sounds like you're really just going through the risks, right? How risky is this restaurant? How risky is this menu item?
Does the wait staff go, I have no idea what you're talking about? That is a part of it too. Like, are you comfortable in this situation? And if you're not, you're still maybe eating socially with people. Maybe you're not eating, but the rest are. Just depends on the situation and how to navigate it. But everything is a calculated risk.
Yeah.
I will say even, just work situations. I remember one time at work, I'm going to assume that I touched maybe a doorknob or something.
Oh my gosh.
And I touched my face and I ended up with a handprint on my face. And I did smell like peanut out in the office. And I thought, oh gosh, somebody's probably eating a peanut butter sandwich. And I didn't realize. But that was just one system. So I didn't take my EpiPen for that. But it's a good reminder that not to be so focused on it that you can't live your life, but to have your awareness up there. I know.
No peanuts wrong, Sarah.
I know. No, it's really okay.
Sarah, there's a video online of a man whose lips tingle when he eats marinara sauce. Maybe it's oral allergy syndrome. So he just puts tape on his lips before he eats pizza. Have you seen this? Is this a possible workaround for an allergy?
I feel weird that I have not seen this video. That seems like something that for sure would have come to my algorithm some way, shape, or form. I haven't seen it. But I would not recommend that as a first line of defense because you're going to eat the food. It's going to go into your mouth.
It's not just your lips.
It's not just about one surface, even with the pollen food allergy syndrome or oral allergy syndrome, that happens in your mouth too. So no, that wouldn't be the best strategy. I mean, creative for sure. Not so evidence-based for sure.
Yes.
Yeah.
For those that are not familiar, how can we read a food label to help identify allergens? Maybe even especially the ones that aren't as common. Because the big 9 are bolded.
Yeah,
is that
oftentimes, yes. Okay. And sometimes they're even called out separately. And so that's nice when you have one of those. And fortunately, all mine fall into that category. So that's good. I didn't talk about it earlier, but I am allergic to sunflower seeds too. So I have to be careful. There's some great whole grain breads out there that have nothing else I'm allergic to, but might include a sunflower seed or a sunflower nut or have them on the outside of the bread. So especially if you have one that's not the big 9, you can't just skip the ingredient label. You do have to read carefully. I know it's kind of a pain, but it's just one of those things you get used to looking for.
And I'm assuming we're also reading, especially with a severe allergy like yours, not an intolerance, processed in facility as well.
Always looking for that. However, that is not a labeling requirement. It is required to call out the allergy, but if they are produced on shared equipment or in a facility, it's not required that manufacturers call that out. So when there are questions like that, sometimes part of the strategy for living with allergies is contacting food manufacturers, understanding which manufacturers tend to be great about that with food allergies and ones that tend to label that way. You do start to kind of learn that a little bit as you go. And that can be a really scary thing. That is our U.S. laws. Canada's labeling laws are great, and you can sometimes trust their labels even a little more than our own.
Always reading labels as dietitians
Label.
Sarah, thank you for sharing not only your personal experience that's really meaningful for myself and our audience, but your expertise. I knew exactly who I was going to ask to talk about this important topic. So thanks for joining me.
This was fun. Thank you, Tara.
There's no true cure for a food allergy, but the science is advancing. Now there are strategies like oral immunotherapy, which trains the immune system to tolerate small doses of your allergen. The key to avoiding an allergic reaction is avoiding the allergen in the first place. That includes avoiding cross-contamination in your home, grocery shopping, and talking about it with your servers at restaurants. Having a food allergy doesn't mean you have to live in fear. Awareness, communication, and an EpiPen in your pocket go a long way. That's all for this episode. But if you have a follow-up question, leave us a voicemail at 507-538-8255. 888-778-6272, and we'll answer it in a future episode. For more On Nutrition episodes and resources, check us out online at mayoclinic.org/onnutrition. And if you found this show helpful, please subscribe and make sure to rate and review us on Apple Podcasts or your favorite podcast app. It really helps others find our show. Thanks for listening. And until next time, eat well and be well.